I'm Priya Baraniak. I'm the Chief Business Officer at OrganaBio, and I also co-lead process development and manufacturing and serve as our laboratory director. So I sit at the intersection of business and the science for the organization, which I really love. And I'm a founding member of the company. I've been with the company over 5 years now. So I know it's World Blood Donor Day, and so our organization has two wholly owned tissue sourcing subsidiaries. One is an adult peripheral blood business, and the other is a birth tissue business where we source cord blood units from mothers who donate them altruistically when they're not banking them. We rely very heavily on our donors and their altruistic donations or compensated donations to provide us with the critical cellular starting materials that are fueling the next generation of life-saving therapies for cancer, now for autoimmune disease, so many indications that we have yet to uncover. One of the things we really focus on at OrganaBio is ethical tissue collection and putting our donors first. We talk as an industry a lot about patients first, and of course, the patient always has to remain the center of the journey. It's why we're here, it's why we're passionate about what we do. But we also have to remember that the donors are a very critical piece of this equation and critical stakeholders in this. So making sure that we are consenting donors properly, that we are keeping their safety at the forefront, whether it's a cord blood collection that has to be secondary to the health of mom and newborn, or an adult peripheral blood collection where we have to make sure that the donor is fit that day. And maybe it's an inconvenience if they're not, but it doesn't matter. Their safety and their well-being has to come first. We have to be educating them about the impacts physically of collection, psychologically of collection, how to take care of themselves before and after the process, as well as about informed consents and what it is that they're consenting to, what rights they're giving up, for how long, the fact that they have the right to revoke that consent as well. And finally, in the context of birth tissue collections as well, we have to make sure that we're consenting mothers well ahead of delivery and not waiting until mom is in one of her most vulnerable periods of time to be asking her to make these decisions.